As an educator, one of the things that I'm really interested in is how do doctors think? How do they learn? And what do they learn right? And what do they learn wrong? And my job is to try and steer future neurologists in the right direction. So one of the complaints that people training in neurology, or training in any field of medicine really have, is that when they're consulted by other fields, the consultation question doesn't make any sense. Everybody in training feels that when they get consulted, they pick up the phone, they get a consult, and they think, this is such an inappropriate consult. And there's a study, a survey study that had shown, there might be as many as 20 million inappropriate referrals in this country in a year. So I did a study at Mount Sinai looking at why do people call inappropriate consults, or more to the point, why do people think that consults are inappropriate? And I think the reason largely, and this is what we studied in this poster that I presented here at the Academy meeting, is that I think people think that what they know is common sense. And so when other people ask them a question, they feel that they should know the answer to this. Neurologists think that other people should know more neurology than they do. But the other people think that we should know more about medicine and other fields than we do. And it sets up this problem that everybody's asking questions that the other field doesn't think is a good question. I think if we educate around some of those assumptions, we can ask each other better questions, and we can collaborate better for the care of patients. Everybody in medicine speaks a different language, and we're such islands. And I think that we have to have a respect for the fact that there's depth of knowledge in other fields that we're not familiar with. And the more we know about that, the better the questions about our patients we can ask. I think part of it is to educate people in a common ground about the medical needs for patients. And so for neurology, I think we need to educate our medicine colleagues about common things. How to approach a seizure, how to approach acute stroke, etc. They really need to know those things. But I think also just training our next generation to be more forgiving, to be more generous, to not assume that everyone should know what they know, I think is going to be a step in the right direction. I think interdisciplinary care is absolutely the future, but it doesn't mean we're going to do it well unless we focus on that. So working in an interprofessional team is an ACGME competency. So for all the residents or residency directors out there who see this or who read this, that's something that we all have to train our people to do. But trying to get at some of the underlying assumptions that make it hard, or things that we could do to foster better collaboration, I think we all should think about. I think at the end of the day, it becomes about patients. It's harder to show the impact of this, but if doctors are making inappropriate referrals, that, number one, wastes time and dollars. It wastes physician time, it wastes patient time, it delays proper diagnosis. And of course, the more collaborative physicians can be across fields, I think the better the care will be. That's part of what the Affordable Care Act mandates. So I do think at the end of the day it affects patients. It's not just about physician satisfaction, although that's a part of it, but it's about the care we can provide. I think that we're all working in teams, either directly or indirectly. I mean, certainly in training, it's almost universally inpatient teams and consultative teams. But even out in practice, even if you're not part of a big health system like Mount Sinai with several different hospitals, you're still collaborating with your peers, you're still sending people for consultations, you're still receiving referrals. I mean, that's the lifeblood of being a modern physician. So I think it applies even in non-academic and non-health system kind of settings.